Berchtesgadener Land in Bavaria, a mountainous idyll on the Austrian border, now the #1 coronavirus hotspot in Germany. The number of new cases there in the last week is 5 times above the threshold for a high-risk area. As of Tuesday, locals are back in lockdown and only allowed to leave their homes with a valid reason. The number of new daily cases in Germany is rising nationwide, with the south and the west worst hit. More than 129 areas are now deemed high risk. As the second wave hits Berlin, authorities are urging people to wear masks in all crowded places where social distancing isn't possible. Masks are compulsory at markets, while queuing and on some shopping streets. For now, the public is largely remaining calm. Of course, we're afraid, but not in the sense that you think about it all the time. But we're protecting ourselves just like before. I still live with my parents, so I won't go panic buying, but I already found it bad the first time around, and this time too. I think we're better prepared this time around compared to the first time. I see how people are behaving, and it's much better. But what it means for us, I'm in Berlin for the first time in 10 months, and of course I'm a bit afraid. In political spheres, pressure is growing for more involvement of the parliament in coronavirus decision-making. Bundestag President Wolfgang Schäuble wrote to MPs on Monday, saying that parliament's role as lawmaker must be more distinct in the handling of the pandemic. A polite reminder that in Germany's democracy, Parliament makes the laws, not the government.
And we are joined now here in the studio we're joined from Berchtesgadener Land by Julia Saudelli. Julia, tell us, why are infections there so high?
Well, on Monday, when the lockdown measures were announced, Minister-President of Bavaria, Söder, suggested that it all could be connected to a party that happened here in the area. Others have alleged that the close area of Curfews in Austria, which has been a hotspot and has been put into lockdown since last week, could have also been a source of new infections. But local authorities here are saying that there is no clear indication that one event triggered the spread of the virus. It is a widespread event. The virus is everywhere here, and they can't trace it back to one single event.
How are people there coping with the lockdown?
Well, people here are going about their business. They are walking their dogs. They're going to the bakery and shopping. They're doing what they are allowed to do. They say that they are okay with the new restrictions, with the stay-at-home order, if that helps bring the infection numbers down. Obviously, they're not very excited of having to spend more time at home, but what they say is that they're lucky that they live in a beautiful mountainous area and that they are still allowed to go out for walks.
Tell us a little bit more about the local economy, because it's highly dependent on tourism. What does that mean for the lockdown?
The situation is troubling for people here. Many own hotels, have businesses, restaurants, or shops. And what we have seen today is a lot of these situations where they are closed. We have seen hotels locked down, restaurants closed, and that is a big loss in income for the owners. 2,500 tourists were here and had to leave suddenly yesterday at 2 p.m. when the lockdown came into effect. And people are worried that these 2 important weeks where a lot of people are on holiday, it is a school fall holiday season, that a lot of these, the money that was meant to come in won't, and that they will have lost it.
Thank you so much. DW's Julia Saudelli reporting from Berchtesgadener Land. We appreciate it. We go first to Spain, which is nearing 1 million COVID-19 infections. Standing by for us in Sevilla is DW's Jan-Philipp Scholz. How is the country there coping with the latest strike?
Well, the situation here in Spain is once again very tense. And what makes it even worse is that the pressure on the healthcare system is rapidly increasing. I received a message from a medical doctor who works in a local hospital here in Sevilla yesterday, and what she wrote really sounds like a cry for help. Let me just quote a few sentences. She writes, "I'm sending you this message because here at the hospital we are deeply worried. The numbers have skyrocketed. The emergency unit is full. It's horrible and it will get even worse. I'm not alarmist, I'm just realistic." And she also says that she feels that in the coming days it's even going to get worse. So I'm afraid no good news at all here from Spain.
Jan-Philipp Scholz in Spain. And Belgium is also one of the corona hotspots in Europe, with new restrictions in place since Monday. Barbara Wesel standing by in Brussels. How's the Belgian government trying to get the outbreak under control?
The Belgian government is desperately trying to stave off a second real lockdown. So they've closed all bars, restaurants. They have put out a nightly curfew. You're not supposed to go out at night at all anymore, limited the sale of alcohol, everything we've already seen in France. But they're also appealing to its citizens to sort of stick to the rules. You're not supposed to meet more than one other person here outside of your direct family. And so they're really playing for time, but the figures seem to be running away for them. They've seen a 70% increase of new infections throughout the last 10 days. And they also fear that by mid-November, all their emergency beds in the hospitals could be full. So desperate holding measures, and they don't know yet whether this is going to work.
Barbara Wesel in Brussels, thank you. And Poland was praised for successfully controlling the virus in March and April. Olivia Kortas is in Warsaw. What's the situation now?
The situation at the moment is really alarming. Earlier this year in spring, Poland introduced one of the earliest and toughest lockdowns of all of Europe and was hit less hard. However, right now the government is failing to curb the infection rates. We hear more and more reports from hospitals that cannot take patients anymore. And at the moment, the government even turns the national stadium in Warsaw into a field hospital. We hear reports that similar emergency entities will be established in the rest of the country. The system is not breaking down yet, but we expect it to reach its limits in a couple of weeks.
Olivia Kortas, thank you so much.